How much do you have to do when you're such a small parish? How many people go there? There's few baptisms, few marriages. Just hang out. Okay, solve all the problems.
Okay. We'll open the meeting tonight at 7 o'clock. I'd like to welcome our guests. We have Elizabethville. There, yes. Trish Barter.
Right here.
Okay. Sue Gowdy. Okay, Marianne Ashley. Marianne.
No, it's Marjorie Alexius, my bad handwriting.
I can't read it. Okay. Okay. All right.
Put it in the minutes.
Oh.
Tell me how to spell it.
Anyone else? Did I miss anyone? I'm going to ask Deb Howard to introduce her husband. Did everyone, by the way, did everyone sign in? Make sure you signed in.
Dennis Henninger.
What?
Did you sign in?
I did not.
He never does. She knows who you are. Deb knows who you are.
I know, yes. Well, I wrote it up for her to read it, but she wants that to read it.
Well, no. Okay, the speaker tonight is going to be Dr. James Bauer. He's actually a local guy who was born in Halifax, November 26th of 1950. He's a son of John, later known as Henny, and Jeannie Bauer. He is one of 5 boys, and his mother did survive. Graduated from Halifax High School in '68, went on to Penn State, then to Hahnemann, where well, he was going to be a vet, but he changed his mind, which is kind of good because he's not too fond of too many animals, like birds or cats.
I would have been a large animal vet.
Yeah, he doesn't like horses.
I like horses, cows.
So he ended up going into pre-med and went on to Hahnemann in Philadelphia, and then did a 3-year residency in internal medicine at Polyclinic Hospital in Harrisburg, where he had the opportunity, well, he met me, but then he also got introduced to Dr. Sherman Harold, who was a local physician in Lyons, who was looking to retire, and Jim knew he wanted to go into family practice, and when Dr. Harold retired, he took over. Dr. Harold retired the last day of June of 1978, which was a Friday, and Jim walked into his office on Saturday morning, July 1st, with the same nurses, same staff, and saw 25 people, and stayed till 44 years. And retired. So we can talk to you about the evolution of medicine. Covered off again.
I decided to make the talk on the evolution of medical care in Upper Dauphin County, rather than just tell. And the thing is, when I tell my story, I think you will see how much the world has changed, and not for the good. Okay? And I think a lot of us already realize that. First of all, as I once said, you know, I grew up on the farm with the white horses. Everybody knows the 2 white horse statues. And in fact, I bought the blocks, I bought the things that the Halifax Society does at the end. I can just tell in a minute or two all the history of that farm, which is remarkable. Okay? But anyhow, so I grew up on a farm, and I developed an interest in farming, and I decided I would go into veterinary medicine at Penn State. So I signed up to go up to Penn State, got to the main campus for pre-vet. Well, my sophomore year, Ralph Askew called me in, and he said, "You're from Halifax, aren't you?" I said, "Yeah." He said, "How'd you like to be a doctor?" And he said, "I thought about it, you know, but I didn't think, coming from Halifax especially, that I had the academics." He said, "You have the academics, okay?" And at that time, remember President Lyndon Johnson was president, and he had the Great Society programs. And one of those programs was the Hill-Burton Act. The Hill-Burton Act is what built the Frederick Health Center in Millersburg. Remember, under the government, they were going to put Hershey residents there for training in rural medicine. They had quarters downstairs in Frederick where the residents were to stay. they were going to put doctors there for rural medicine because this was a physician shortage area. Well, that led, for me being from Halifax, Todd was a Navy doctor, of course nobody had swagger, but anyhow, as you said, what we can do is I can put you in the MECO program. That was Medical Education and Community Organization. So he said, I said, well, you know, I think about it. And he said, all we would ask you to do from pre-vet to pre-med, he said, you will have to take quantum mechanics, which you don't take as a vet, and you would have to take organic chemistry synthesis, which you do not take in pre-vet. And he said, since you came from Halifax, we would make you take Math 41, which is not even a college level course, transition you from Newtonian mechanics to quantum mechanics. So, but anyhow, I said, well, but you know, I can go to the vet school of my choice in 3 years. He said, we can fix that. And the arrogance, you know, and here's a guy offering me a medical school admission with a full scholarship. And well, I can go to vet school in 3. He says, we can send you to Hahnemann, and then we would take your first year at Hahnemann, we will count it as your 4th year at Penn State. So we will graduate you magna cum laude in pre-med with your first year at Hahnemann. I said, okay. So, they put me in the MECO program. They gave me summer employment, okay? And under that program, they gave me summer employment at Evangelical Hospital in Lewisburg, and the following year, again, at Evangelical, where because they wanted to take us farm boys and get us into medicine, you know, at least be exposed to it. And you stayed at Lewisburg, you stayed in the hospital. I was there up during the '72 flood. You know, and I remember Strine and all those guys up there. Evangelical Hospital was a nice hospital in Lewisburg. So now, and he also explained, when you go into the MECO program, they give you a full scholarship. They also explained that you are under absolutely no obligation to practice medicine in a rural community. We're going to educate you with the hope that you will return and practice medicine in rural Pennsylvania. So, you know, so anyhow, I said, okay. By the way, that program was written up in the New England Journal, and they took 12 of us farm boys from rural Pennsylvania. Every single one of the 12 farm boys from rural Pennsylvania returned and practiced medicine in rural Pennsylvania. All 12. They also took 6 blacks from inner city Philadelphia. And not one of those 6 blacks went back to the ghetto. So it goes to show you the program, it was very effective in terms of rural medicine, but not in urban medicine. I mean, for the blacks, that was their ticket out. You know, they all went into super subspecialties. One became a pediatric orthopedist at Pitt. You know, one is a neurosurgeon. And it goes to show you that that's the way the program was set up. Of course, then in 1968, as you know, Hubert Humphrey lost to Richard Nixon. The Republicans came into power and wiped out all of President Johnson's Great Society programs. So I lost my scholarship for the last 3 years to Hahnemann. Well, it was only $1,200 a year. We just buckled down and paid it. Or I borrowed it. I ended up coming out of Hahnemann owing only $10,000, all the total, everything. Because see, I had to buy and rent an apartment, I had to pay my board, I had to travel, you know, I only owed $10,000. So I went to, and I wanted to do rural medicine in this area. So I went to be a resident, and I wanted to do internal medicine. So I became a resident at Harrisburg Polyclinic Hospital. So, and the reason I wanted to do internal medicine rather than family medicine was because I liked cardiology. Back in those days, they used to let us kids do heart caths. You know, crazy Carl would say, hey, you go down and open them up and fool around in it. I'll be down in a couple of minutes. You know, we should go down and do the prelims. So, of course, that really upset Wanamaker, who was chair of the department. He said, you shouldn't let these kids be doing hard tests. But anyhow, but I really thought I was going to, when I was at Polyclinic, Dr. Harold had a heart attack. He comes in, the CCU, of course, my wife was, she was head nurse of the CCU, head nurse of the ICU. I was a resident. That's how we met, you know, over time. But anyhow, and he said, I'm looking for somebody to replace me. And see, back in 1968, medical care, you had the Hottensteins in Millersburg. You had Dr. Buxton in Eville. You had Dr. Horn in Gratz. You had Huffman and Harold, okay, up in Likens. You had Dr. Doe, you know, up in Tower City. I mean, he was there, what, for about 50 years? I mean, I only practiced like 43. He was there like 50, I guess. But, and I think Williamstown, I think, had Person, or a couple there too. But anyhow, you had individual towns, all had their resident physicians. You knew your people, and you took care of your people. And you knew them, and you were part of the community. So he said, I don't want to retire. He wouldn't retire, even though he's 72. He says, I wasn't going to retire until I had somebody who I knew would take care of my patients. So I said, I wasn't really doing that, because you're going into an established practice. So I used to go up there, and for all intents and purposes, he literally, like, gave me his practice. He just said, take care of my people. That's all I asked. So he would take me on house calls. Every Thursday, he would have like 5 or 6 house calls, you know, or take me on house call, you know, while I was still in residency, just to get to know the people. And then on June 30th, 1978, he walked out. And July 1st, 1978, was a Saturday. I took over, saw 30 people the first day.
Wow.
We averaged about 60 people a day, you know, up there, because you were the only doctor. And, you know, I kept the same staff, the same people, the same techniques, and I figured I can gradually evolve our medicine. But you don't go into a new town like that and say, well, I'm going to do everything different. So, now, he used to have office hours on Saturday night. He had office hours like every night. I got rid of those. I had office hours 3 nights a week, you know, because people work for a living, okay? And then gradually, you know, we sort of got that worked out. But he had 4 RNs that worked for him. So, and I just kept those 4 people for years and years and years and years. So, and it was really, you were in the community, you were involved in the community. We had Elizabeth was born in 1978. You know, my kids grew up in the community. I was president of Little League for what, about 5 years by default. Nobody else would take it. And flotilla commander in Millersburg, you know, of the Coast Guard. And you were in it, and it was just a lot of fun. And I figured, I'm never going to retire. Medicine has changed. Medicine has evolved. You know, where we used to go to the private individuals, every town had their doctor. And by the way, when I was a resident, Joe Kreiser was a resident a year under me. So he came up to Millersburg. Art Hodge was a resident under me. He came to Williamstown for several years. And Kendra Fear Cuskin, they were residents when I was residents. We all came up here. Kendra, Fear, Cuskin, Bauer, Hodge, all of them. So, as one, of course, one bad thing about that is we all sort of aged and retired. Yeah. So, and that time just flew by because, fortunately, my wife tolerated that because you're always busy doing things. But you know, so what? You get called. You get a call, you do one of 3 things. Either call a prescription, you see them in the morning, or you send them to the hospital, or especially the first 20 years of my practice, I would see a lot of people at home sew them up. I almost had to trach a kid on the kitchen table, but I got him breathing by hyperflexion. Okay? Almost. I made the cut, but then I didn't go through the trachea. But those are exciting things to do. Teach it, and it's all part of what you do. And you're just, and you feel like you're a part of the community, and it goes on and on and on, and then things started to change. The first thing that changed was computers. In that, I used to try to recruit. I think I tried to have Bernie Shearer. He was from out near Latrobe, Pennsylvania. Bernie just didn't like primary care. I think Dennis Bikini would have stayed. He was only here for about 6 months, but his wife didn't like it up here. Because this is sort of like an isolated area. It's hard to get a professional, and there's no professional community up here. Not with a lot of depth. So I just figured, well, I'll go into them. And I didn't mind it because somebody calls you, you just call in a prescription, you go to the hospital, see you in the morning, or I sewed up a lot of people at home. So they know my kids. My kids know how to sew people. Little stuff like that. But then those computers came in, and then to be a Medicare participating doctor, you had to have a computer. You can't do it any other way. You have to have computers. So then you get the cost of the computers. You get the cost of, you have to buy the software. You have to buy the updates for software. Then you get into the liabilities of computers. So, and I figured at that point I was all ready to just, I was going to practice forever. But things changed. Okay? I'd like to just emphasize, though, that one of the reasons that I was able to practice medicine the way I did was, or the way I wanted to, was more because of my staff. We had a policy that I usually get in 6:30 in the morning. I usually saw a patient or two. They would come in about 7 o'clock, and we stayed till we were done. People don't get sick by appointment, okay? So some days we would be done at 2:30, 3 o'clock. Maybe only see 30, 40 people. Some days we would get done at 5:30. Maybe see 60 people that day. Why? People don't get sick by appointment. So, and my staff was willing to tolerate that. They stayed with me. They knew my patients. Especially when I first, and they knew my patients better than I. They picked up a lot of my mistakes. More than once, they knew how to judiciously say, you shouldn't, you think this is the best way to handle this? No. And then I would rethink it and do it right. Now, I guess actually the limitations is over now. I don't know what it is for medicine 50 years, but when I was a resident and Dr. Harold had his heart attack, he used to take prescription pads and he would just sign them.
Yep.
And then he would give them to the nurses. And the nurses would take care of his people. And 100% of the time, that's what the people preferred and wanted. Okay? Because and it's just the way medicine was back then. People had, they had a lot of respect for their town doctors. So, and their town doctors took care of them. Now, let's see here. I have some other things in here that I'll tell you that affected my life and practice up here, but I'll get into those a little bit later, or stay into the medicine area. Now, you say, the last 5 years of my practice was where I suffered burnout. And that was because I had to join family practice. Now, the main reasons were, first of all, you have to have computers to be into Medicare. You have the cost of the computer, you have the training of the staff, the cost of the updates, and the liability. Now, because you're all familiar with, that was in the paper when family practice computers were hacked. and all the liability and suits they had, because this information is disseminated. The other thing is, family practice. I don't know if most people realize how big that is. They go from Williamsport to Maryland, but they stay in the state of Pennsylvania, and from Johnstown to New Jersey. They have, well, when I was there, they probably only had like 130 different providers. That's MDs,
No.
DOs.
It was closer to 200, I think. But
Yeah, closer to 200 by the time I was out. MDs, DOs, physician
Yeah.
assistants, okay? And it is a huge organization. So, first of all, insurance. My liability insurance was $12,000, it dropped to $8,000, okay? The reimbursement was another thing. When I went to them, they would say, like, what do you get for a Blue Cross 22176 visit? The wife would say, oh, we get 68. We get 84. What do you get for this? Oh, we get 84. We get 102. Why? They are so big and so powerful, they negotiate that you will pay us more, or we won't see your patients. I don't know if any of you were involved. Every once in a while, they would blackball a company who wouldn't meet their standards until they come up and do that. See, I couldn't negotiate because I was a little kid in Lycans. They don't care about me. The other thing was, now we did negotiate one thing that they almost insisted upon, but I refused. This was a phone system. I think when you call a doctor's office, somebody should answer the phone. A human being. You don't know that some old person who can't talk, you don't know if it's somebody confused, you don't know if it's somebody in distress. Don't give them an answering. Oh, well, you got to go to an answering system because you're saved this much money. Nope. But they let me go with that. The second one is keeping my personnel. I had the highest paid medical assistants in the whole system. They bitched about that because what does that do? That affects their labor negotiations. So the other one was they don't like you making house calls because house calls, they are not efficient. You don't have your lab, you don't have your EKG, you can't help people. But that's not what house calls are about. You pick the patients, you see them when you need to see them, and let's say you have some guy who's stroked out. It's hard for him to get out. The last 2 years of my practice, I was seeing someone who otherwise was paying $300 to have a person transport come over, put him in an ambulance, take him to the doctor, and bring him back. Well, why not stop in, draw his blood, see him every couple months? And he was a farmer, so we could talk about dairy cows versus beef, stuff like that. So, and the other thing is the system now got into the point where the government requires certain things. When you go there, you know how they do a depression screen. You know how you do this. You know how you do that. That all adds into the bill. Okay, and if you don't do them, you're penalized. Secondly is, now the system is set up that if your patients do not do certain preventative procedures, you, as the physician, are personally penalized. If they don't get their colonoscopy, if they don't get their mammogram, if they don't get this vaccine. And in fact, there have been patients in family practice, I can't say that. I know of physicians, I better say this, I know of physicians who will not see the Amish because the Amish will not do that stuff. And if you don't do it, Medicare punishes you. The government punishes you in terms of your reimbursements because you're not practicing good medicine. You're not telling these people what they have to do, which I don't agree with. I think is so. You also on call. They would prefer you go into their on call system because the less of us that are in it, like when Dr. Nasuti was in that system, he was on call every 17th night, every 17th weekend. He said the nice thing about that is you're never on call. The bad thing about that is even when you are on call, they have banks of nurses that filter all the calls. So he said it isn't that bad. But the point is you're not in touch with your patients. By being on call and always talking to them, you get a feeling who's calling you, why. You know, this person's getting into trouble. And so that's the other reason I just like to take my own calls. Now this is a general change in medicine. When I came out of medicine, like 1978, let's say even 19, for about 12, 15 years, if I had a problem, I had a direct relationship with my specialist. So if I had a patient who I was having a problem with, I could call up Dr. Wenger, who's a surgeon, and say, Paul, I'm having a problem. He said, can you do me a favor? Can you do this? Can you do that? He said, sure. Now, some of that was based on if he upset me, I wasn't going to refer him any more patients. You know? But at the same time, but at the same time, it was a symbiotic relationship because he knew that I wanted this patient managed this way and he would do it. That doesn't exist anymore. What I think of most with that is when we were out in, first of all, I don't believe in smartphones. This is a story in itself because when family practice had their computer system hacked, okay, everything had to go back through me, had to come back to me for votes, and so forth and info, through a smartphone with security. So they had to do everything through the wife's phone. Because I only believe in football.
And he doesn't know how to use a smartphone.
I don't know how to use them. I don't know how to use one of those smartphones. Okay? I figured I like a flip phone. And the other thing is, when you have the other reason to answer your own calls is we have a large Amish population. And they can call you, but you can't call them. Because their phone's in the barn and all it has on is a light. Because they're allowed to have a phone in the barn for emergencies. So the nice thing about having a flip phone or my own phone and always being on call, when they call, you answer. Then you can get things resolved. You aren't playing phone tag. So anyhow, we got all that resolved through the flip phone, through the wife's phone. So don't worry, they were, family practice was glad to get rid of me. They wanted to get us old guys out of the picture, We're a bad influence. So, but in things, I remember I was talking about how, well, when we were out in Mount Rushmore, on vacation, it would have had a bird if family practice would have heard about this one.
You weren't with them yet.
Weren't we? Okay.
No, because that was one of our baptisms. That was with.
But that better reflects on Jeff's. Anyhow.
Yeah, you took your computer.
Yeah, I took my computer along. Because you can answer calls, send in prescriptions and everything. So you're out in Mount Rushmore, and of course the biggest thing there is you only get internet on the top of the hill. You go down the valley, you're off the internet. Then you go back. So you have to come in and out. And I had a patient who called me. His brother was having chest pain, and he refused to go to the hospital. So I called up Jeff Fugate, cardiologist. We were residents together. And Jeff and his family, Fugate, they are just unbelievable physician families. They really cared for and took care of their people. So I called up Jeff Fugate. He said, I take care of it. So he calls up this patient's brother, brings him in, casts him, puts a stent in him, and sends him home. That's the communication you have, with it. Because the guy's brother wouldn't go to the hospital. We get a little bit stiff-minded up here. Then meanwhile, probably about the last year I was at family practice, Jeff went over and he's now working as a cardiologist at Hershey. And I called up Hershey and said, I want to talk to Jeff Fugate about a common patient. They wouldn't let me talk to him. I have to make an appointment. he's on rounds. I never got to talk to him, you know? It's a different world. Before, a physician to physician communication was golden. It was never questioned. You drop everything and you do it. Not anymore. Now the nurses intercept you, the MBAs, Masters of Business Administration. See, if I'm tying up Jeff and talking to him about that patient, first of all, he's not out on rounds making that money, and they don't get a consulting fee. You have to consult to get to him anymore. I mean, it's crazy. So, and it used to be, so it was written, so it was done. I was used to the days when physicians, when we wrote an order, it was done. Now, it could be questioned by the nurses, and you would explain it, but it was done. Nowadays, well. So, but anyhow, and I think that I really burned out my April of my last year. But I just sort of doubled down, did the best. I had to get my patients ready for, I call it industrial medicine, because that's what we're getting into now. You know, these kids are now physicians, 8 to 5, 5 days a week, get your paycheck and go home. I've been at recruiting meetings where not all, by any means, but a number of them will insist that they not be assigned to a family practice office within 20 miles of where they live. They don't want to see their patients at Walmart. You know, they don't want to see their, it's just a totally different system. So, and of course, in the other year, the one that really bothered me with, he was from Mechanicsburg area. And he says, well, you know, I'm making about $180,000 a year, but I got an offer for $192 up in Boston. The wife and I are moving. I said, I thought, you've been in Mechanicsburg for 8 years. What about your patients? We want to change, you know, move to Boston. Yep. So, but pardon?
What was he gonna pay to live in?
I know. Don't worry, the wife and I, we took a vacation up through Boston. Yeah, it's expensive up there. And their tips up there are, you either give 20, 25, or 30. You know? And McDonald's is even eating. You get so cheap. God, anyhow. But I thought you're going to lose money going to Boston, you know, for near 10 grand. So, but it's just a different atmosphere now. Now, I will admit that there are other factors. Like I said, when I graduated from Hahnemann, I owed $10,000 a year, $10,000 total. Well, I paid that off my first year. I mean, literally, you just save everything up, and you're really busy. Now these kids come out hundreds of thousands of dollars in debt. The other thing, when I came out, Dr. Harold gave me, for all practical purposes, gave me his practice. Because his only concept was he was not going to retire until he had somebody he felt would take care of his people. That's the way he felt. So, so it's a different world. And I think we are going to have to adjust to, and that's why I titled this The Evolution of Medical Care in Upper Dauphin County. Well, that's why I entitled this The Evolution of Medical Care. We are now, and I think are going to have to adjust to the concept of industrial medicine. You know, they're being paid. The other thing is I never had a PA. It's just part of my philosophy. I don't believe in physician assistants, okay, in primary care. Because I don't want anybody between me and my patient. I don't want anybody else between me and my patient. I want to know what they're thinking and they're doing. And, you know, this is because of a competency. It's just that my philosophy is you put nobody between you and your patient. So I never had a PA, although I've had several who wanted to come. That's why I call it the evolution of medical care. Now, you'll notice, though, they try to keep an MD or a DO in every family practice office, at least one. okay? I don't know if they're gonna be always able to do that. Because, you know, you can pick, PAs are a lot cheaper, and they're paid the same. Medicare, you know, they're paid the same. So, if you can get a PA for $100 grand, and it's gonna take you $250,000 to get an MD or a DO, what are you gonna do? The other thing that I think is misunderstood too is if you go back to your demographics. I reviewed the demographics for Upper Dauphin County, and there are only, in all this area, and this surprised me, there are only 2 provinces, if you want to call them that have gained in population since 2010. And that is Lycans, from the 2010 to the 2020 census, has picked up 48 people. But that is because of the hotel and Section 8 housing. The only other one is Middle Paxton Township, Middle Paxton, which directly surrounds Millersburg. And there you're probably getting the development of the Heinball Farm and some of those developments. They picked up about 40 people. But it's surprising. Pardon?
Upper Paxton.
Upper Paxton, okay. They picked up about 40 people. But it surprised me, Wayne Township is dropping. And you know, Wayne Township is where all the big money is. You know, the $1 million houses and all that. Halifax is dropping. Evo is dropping. Washington Township is dropping in population. That surprised me, if you compare the 2010 to the 2020. So in other words, in terms of demographics, when the powers that be look at Upper Dauphin County, they see a dropping population, and Upper Dauphin County north of Peters Mountain. I forget how, it's like they have like 12,500 people live in Upper Dauphin County, north of Peters Mountain. Meanwhile, and that's 2/3 of the county, south of Peters Mountain is 250,000. Okay, so what are you going to, and the population is dropping. It's going to be hard for us to get medical care up here. It's even hard. I don't even know if like CVS could put in an urgent care. I don't know. So, yeah. So anyhow, I am just glad that I lived and I practiced when I did. Because if I was looking at this scene today, I don't know. You know, I would have to choose other options.
You'd be a vet.
I'd be a vet. But I'd be a large animal vet.
Cows only.
Not horses, they're too mean. Cows.
You were going to cardiology.
Oh yeah, I could have been a cardiologist too. But then, the only trouble I didn't like about cardiology, you do a heart cath, you stent somebody, you send them out, you don't see them again. You know, I wanted more or less that relationship. But I do want to stress that one of the things that really was primary to the way I could practice, which was unique, was my staff was always with me. You know, Ginger was with me for what, 30 years?
A long time.
And I kept all his 4 RNs.
Yeah.
Okay. Now there are a few things that I also that I ran into. One is that if you cannot, as a physician, as a private physician, I cannot see patients who are in HMOs. And the Supreme Court has held that up twice. You know, because what happened was an HMO patient went out of the HMO, see a doctor. They recommend the first one was for a bone marrow transplant for a metastatic breast cancer. Well, the Supreme Court ruled that in order for the HMO to be able to control costs, they do not have to offer that patient that service. And then there was another one, HMO. So when you sign an HMO, you know, or certain Medicare Advantage plans, you have to watch.
Big thing is now, if you are in a group and that group has it, you're covered under them.
Right.
Yeah.
Yep. But see, back then I wasn't. No.
Back up, you said if you're in an Advantage plan,
You have to watch. Are Advantage plans HMOs?
No.
No. Okay.
Some of them are.
They're PPOs.
Most of them are PPOs, but some,
Okay.
they're all, yeah, you just have to watch what you're doing.
Right.
Yeah.
So pronunciation of, oh, the other thing I have. You're going to hear about concierge medicine. I basically practice concierge medicine. In other words, concierge medicine is where you might pay a physician $1,000, $2,000, $3,000 a year to have access to them. Okay?
Yeah.
I don't believe in that. Okay, I just don't believe in that. I was trained not to believe in that. So,
Some are doing it.
okay,
Yeah.
yeah. So, anyway, I probably, oh my gosh, holy smokes. Yep. Are there any questions? Any other questions?
She's
Oh,
Okay. Trish, did you have a question?
What does HMO stand for?
Health Maintenance Organization. HMO, Health Maintenance Organization. Now, I can do this in about 2 minutes if you want to hear the history of the farm where I grew up. Okay, it's known as the farm with the white horses. Of course, you have these. These are also done for Eville. We have one of our house, I think,
Yeah.
and everything. Those 2 white horses, back in just after World War II, about 1946, they were one of 6 horses that were linked to a Conestoga wagon which ran along the main trail through Lancaster, Pennsylvania, and that was used as an advertisement. I think it was for a hotel restaurant. Well, that was dismantled. 2 of those horses went to Mount Joy, and the 2 we have are they were for a milk wagon. They were hooked to a milk wagon and were used as an advertisement for a milk wagon for a dairy in Mount Joy, Pennsylvania. In 1950, and this is the way the world worked back then. In 1950, Bertie Fairchild, who owned the Red Rose Motel, bought them, from Mount Joy, brought them up to the Red Rose Motel. And he came down to Henny Huffman one time. He said, Henny, he said, those horses should be on a farm. So he picked them up, put them on the farm. And ever since 1950, that has been the farm's landmark, the 2 white horses. Now, we had them back on the tennis court about a year ago or 2, and we redid them because they're steel and concrete, and they each weigh over 1,000 pounds apiece. So we had to have John Strohecker came in, and cast iron. And you know how to weld cast iron. That's not easy. But anyhow, he did it. We got them working. Now they're back out. And we built a little cupola. That cupola is 8 by 16. The barn is 50 by 100. So it's supposed to mirror that. Then when you're a little kid growing up, I never realized the house I was growing up in was, they have it here as a mansion on the hill, because back then the road was down where the railroad is. So you look up at the hill, and that was called the mansion on the hill. That brick house, the house is described on the 1756 William Penn Charter Grant, which is in the courthouse, to Sam Bowes. Now, but the house described on the land grant charter deed of William Penn is wood. So what happened was, it was a wooden structure. That was in 1756. Then what happened was, when the house was owned by Colonel James Freeland, and he was a cavalry officer in the Civil War, fought in the Battle of Gettysburg. He was a legislator, and he was also a Mason. So when we had the sale of that, my mother, in all her wisdom, said that when she dies, we're going to have a public sale, and you just sell everything. Okay? So they had 2 books of cavalry, how to manage cavalry. They went for $600. Just amazing. The ones that really brought even more, the Masons. He had the full set of the Masons books, whatever they are. They sold all those. So I used to read them when I was a kid. But you didn't understand what you were reading. You know what I mean? It's just all these rituals, and all these dead stuff laying around. But anyhow, And he's the one who built that brick house. Now, we think the brick house was built about 1820. By the way, the big pine tree we took down was 85 years old. Counted the rings. That's all the older it was. Mike thought, that tree saw this house grow up. You know, saw that house built. No, it's only 85 years old. So, but anyhow, the house, Sam Bowes had 5 sons. I was one of 5 boys. So Sam Bowes, just by coincidence, Sam Bowes divided his 335 acres and gave each of his 5 sons 67 acres. And we were the middle, 67 acres. Now, since then, my mother bought 3 acres along the river, because we have own all that. But then you had the Mater farm, the Shepley farm, which was chickens, the Bauer farm, and now our 6th generation lives there. Henny Huffman bought that in the 1930s for taxes, okay? And then Henny Huffman, and then Herbie Huffman, that's how we were in the Huffman estate, okay? We got through that, through the Huffman estate. So we inherited that through the Huffman estate. So, and then of course you had the Troutman farm, which was dairy, and then you had the Mailhorn farm. So ours is the middle farm. That's the only one left intact with land along the river. So, because my father said, as long as he's alive, nobody's developing this river ground. You know, in the camps or anything, except us. Nobody. And, you know, I kept that tradition up, and hopefully now Jamie and Josh will keep the tradition up. They'll just stay in the family.
Does your land border Halifax? The Halifax fort?
Oh, no. No, we're midway between the river, just below Whitmer Motors.
Yeah, I know.
Yeah, Campbell's Pet and Feed.
Yep.
Yeah, you have to go all the way down there
farther.
to the
Okay.
Yeager farm to get into Halifax. Yeah. Yep. So,
Who's the Henny Huffman you're talking about? Is that the Henny Huffman that had the store in Millersburg?
that was Herbie Huffman. See, Henny Huffman, then his son was Herbie Huffman. Henny had 3 kids, Herbie Huffman, Grace, she married a mater, and Margaret. Margaret Huffman was my mother's mother. She married Clifford S. Miller. So that was Margaret Miller. She died of leukemia when she was in her 30s or 40s.
Yeah, your mom was like 14, I think, when
Right.
she died.
And then see, Herbie Huffman, he married Rachel, had no children. The Grace Huffman married a mater. They had a baby that died soon after birth. And then her husband, Harry Mater, he died of a pulmonary embolus. They call it a heart attack, but it was a pulmonary embolus because he broke his leg and he was in a cast up the ear. But you know, back then, they said it was a heart attack. It was a pulmonary embolus. You know, they didn't do autopsies. So then the only surviving part of the Huffman estate was Margaret Huffman, who married Clifford S. Miller, had 2 kids. Clifford S. Miller III, better known as Bud, and my mother. So, any other questions?
Just going back to your medical career.
Yeah.
What were some of the things you love to do or like to do more than others?
I don't know. I used to circumcise a lot of Amish babies.
Really?
Yeah, really?
Oh yeah, yeah. I
Did
did.
it in Minneapolis?
Yeah.
Did it in Minneapolis?
Yeah, I do Placerville. Yeah. And I don't know. I just liked it all.
Okay.
You know, I like
I thought maybe there was one aspect.
Oh yeah, no. Especially when you get involvement in families, you know, terminal care, stuff like that. You get to know people, you know how they think.
Okay.
Yeah. I mean, it was a lot of fun until the last 5 years, and then it became a chore. You're always here, but I will have to. My staff, my wife, Barb Buffington,
Yeah.
she really. She probably kept me out of jail. So, no, family practice couldn't put me in jail. They could harass me. okay?
Yeah.
But they couldn't put me in jail.
Yeah,
But anyway, so anyhow,
could,
yeah,
yeah.
they absorbed a lot.
Okay.
Because they just wanted me to conform to a lot of their policies that I would not do. So, but overall, if I had to do, if I had to do over again back then, I would do it again.
Okay.
Yeah. But I would say, once I got into industrial medicine, computers, all that craziness, and then, you know, you start, like, I couldn't call up Jeff and talk to him, you know, and just all your restrictions came into place, and it just wasn't, it wasn't fun anymore.
Okay.
It wasn't fun anymore.
It's a whole new world.
It is, it's a
It
whole
is,
new
yeah.
world. And, you know, I didn't know if I could use up 20 minutes, but, okay. I
Oh,
knew
yeah.
about other things about how growing up, how the world has changed. You know, so, and we're just gonna have to get used to it.
Don't depress us more.
Yeah, I won't depress you more, because, you know, I don't think we can change it. How could you reverse this? You know?
Jim.
Yeah,
We're finding this through UPMC. Every time I go to the doctor, I get a different doctor.
yeah. It's gonna get worse. You're still seeing doctors. Okay.
Yeah.
Okay.
Well, what I'm doing is following my doctor that moved.
Oh, okay, yeah. Yeah. So, yeah, I can't.